Good afternoon, everybody. It's a great pleasure and honor for me to be here this afternoon and to be part of the UCU Wellness Week. I want to thank God for the day and for the activities that have been taking place. I also want to pass my appreciation to the organizers for extending the invitation to me, but I think in a very special way to thank them for choosing the theme for this time around, which is on mental health. I've been very passionate about mental health for many years. Like you've heard, I've been to Butavika a long time helping people struggling in different ways. So thank you so much for that theme, especially bringing up the topic of depression, something that is affecting many people in the world and in our country. A lot has been shared already on the theme in the area of depression. Various aspects have been tackled, religious, social, family, and so on and so forth. And all these certainly do complement each other. I will be tackling the medical aspect largely to see how we help people that suffer depression. But I think my most important, and I pray to God that I achieve the objective, is more to, in a very simple way, create awareness on this subject so that we are able to identify people going through these challenges and see how we help them to go through the struggles and also help them to get well. This would be really good for me if I can just achieve that objective. So if you can now project my slides, the first one. Depression, I think I'll start by sharing something on mood, how depression comes about. What we know, first of all, is that it is itself a very, very, very common problem. I'm sorry, I might be turning here a little because the font there is a bit little tiny for my old eyes. But mood is a very common problem, as we shall see later. But we shall start by appreciating okay, maybe it can be helpful. It's better. Hello? Yeah, thank you. So mood, like we shall see, or depression, is a mood problem, which is the internal experience of one's emotional state. And it tends to take three dimensions. We know when we are looking at mood, it can be normal. That's how probably all of us are feeling now. But sometimes that mood changes to a higher level. And when it's high, it's elevated, somebody becomes extremely happy, maybe is laughing a lot, is talking a lot, and we say the mood has changed to that high level. And that sometimes can be problematic. Today we are not looking at that higher mood. We are looking at the next one, which is the low mood, when it has gone low and somebody is feeling uncomfortable, is unhappy, is feeling sad, and so on and so forth. So we say that mood is low. When mood is low, then we say the person is depressed. But depression is not always a problem. It's something that we always go through, something that we always suffer, especially when we meet challenges that stress us. But God made it such that it comes for a short time and usually it disappears. It doesn't stay long. So that's why we say it's something that is many times normal. The only challenge comes when mood is on and it stays a long time. It stays many days. And usually we talk about staying over a period of 2 weeks. When you are experiencing it all the time, every day, for that length of time, then we begin to say, I think there's a problem. I think you need to be helped if you've gone that far. So that will mean if it has stayed that long, then the disease of depression will have come on. If we can go to the next one. Next one. Controller. Okay, no problem. Okay. So, as we said, it's a very common problem. And there are studies that are now showing that it is the single largest contributor to global disability. Depression may not be that a killer. It doesn't kill so much, but it causes a lot of discomfort. It causes a lot of disability. It makes people to be dysfunctional. And when you rate that, it comes the number one disease in terms of disability. However, it doesn't stop there. It also kills. A lot of people die because of depression through suicide. And you know, each year we lose over 1 million people to suicide globally. That means each day about 200 people kill themselves as we move. And they are killing themselves because they are depressed. So much as it just causes a lot of disability, it contributes to death through suicide. In our communities, the environment we are in, we estimate that about 8 to 12% of people in our communities do suffer contribution. And when we look at, for instance, people who go to visit health facilities on a daily basis at a primary care level, we see about 10 to 20% of them are visiting the facilities because of depression. But like we shall see, sometimes depression doesn't manifest directly as the way we think about just feeling low. Others it presents with various body pains. People go to consult for those pains and end up actually being people with depression. Of course, we are now in a very, very tricky period of this COVID pandemic. And what this has done, as you are all aware, is that it has increased the burden of mental health. And specifically for the two diseases of depression and anxiety. Many people out of COVID, directly or indirectly, are suffering from depressive features. They are suffering from anxiety. Students not going to school, people not working, income reduced, no food on the table, diseases, loss of relatives, so lots of problems. These have increased the burden of depression in our communities. In some countries where some studies have been already done, there are studies from Spain, for example, they are talking of an increase, a 7-fold increase in the number of people that are suffering from depression. In some countries, 4 times what it was before COVID came in. So, of course, we are now at a very difficult time, and that's partly the reason I'm glad that the organizers thought about this very, very common problem that we are having to deal with currently. Depression cuts across age groups. It's not a disease for a certain section of people. We get young people suffering depression, adolescents, adults, and the elderly. We see more of the disease among the elderly, but we are also seeing it commonly among, like during this particular period, among the adolescents. So we shouldn't leave anybody behind thinking they are safe from depression. It can really attack anybody. We sometimes find that the females do suffer more commonly than the male for various reasons that you might know. There are hormonal issues, but the females generally go through a lot of challenges, family, production, giving birth to life, and so on and so forth. So those increase their vulnerability, and we find we get more people with depression among the female than the other. I also want to observe that we know that God brought up a number of diseases, new diseases coming on board. COVID is new. We had HIV, AIDS, and so on. But depression is a disease that has existed for a long time. It's talked about a lot in the Bible. Maybe not directly, but the implications when you read the various verses, you know there must have been a problem here, maybe of depression. For example, if you look at Jonah, after a series of events in Jonah chapter 4, Jonah was saying to God that, God, take away my life. It's better for me to die than to be alive. So when expressions of this kind come on board, we shall see later, these are some of the signs of depression. When people begin to give up on life and say they are better off dead than alive, then you know they've gone into depression. In Kings, I think Elijah, after was weary and was saying, Lord, take away my life. I've had enough. I don't think I'm even better than my ancestors. So Elijah was also saying, like, life was not worth living anymore, and he preferred to go and die. And others, David and so on. So this is not a new disease. It has existed for a long time. From the medical point of view, like I said, I'm mainly tackling the medical aspect. There are a number of causes that have been put forward. Depression comes on because of certain chemicals in the brain, which are normally there in adequate quantities, but when depression sets in at the disease, we find the levels of those chemicals have gone down. And this is supported by the fact that we are now able to get medicines that when we give to people, the levels of these chemicals get raised again, and people do get better. So the biological theory is there, and it is used a lot to support people who are suffering. We know also that this disease takes a genetic trend, that it can be passed on from parents to children. And what we see is that, for example, in a family, if one parent suffers depression, then the offsprings, the children, have a 30% chance of also suffering depression. But if in the family, unfortunately, both father and mother suffer depression, then the child has a 60% chance of also suffering depression. That's why you find some families where there are people that have, one has developed a problem, maybe you find another child also develops a problem. That's why when we go to communities, there are families, they say, in that family, people commit suicide. Because they know that because somebody suffered depression, committed suicide, there were chances that another one could also suffer the problem and also kill himself or kill herself. So that supports the genetic factors. But also, thirdly, there are all these environmental factors, psychosocial, that people go through that make them really vulnerable and easier to suffer the disease. So the various life stresses, academic pressure, failing exams, poverty, landslides, floods, motor accidents with injuries, now the various forms of insecurity that take place. All these really, there are as many as there are people in this world. So all those, when they happen, they do cause people to go into facing challenges with depression as a disease. So at the end of the day, you find that many times it's not a single factor operating, but it's a combination of factors that get together and somebody develops a problem. So if somebody is vulnerable, for example, is from a family where depression exists and meets a difficult situation, maybe fails exams, then that person will very easily develop the disease. We shall quickly go to how do we see people that, how do we recognize them? Because that's also important to know who is suffering depression, how do they suffer. These are like the common signs and symptoms. The key one, the number one sign, or call it symptom, is a low mood, feeling low, feeling sad. A person who suffers depression will many times express this, that I don't feel well, I feel sad, I feel unhappy. The majority of them do recognize that. So we take that as what we call a cardinal sign, a very important sign for somebody to feel that. Then on top of that, others do come in, losing interest in things that they previously enjoyed. So you may find a student that was on top of class, is losing interest in studies, doesn't even attend lectures, and so on and so forth. So lack of interest usually accompanies low mood. They lose energy, they are weak, getting out of the bed becomes a problem, and they start feeling very, very negative about future, themselves, and lots of other things. Now, a lot of times, depression is also associated with anxiety. Anxiety is some kind of fear, feeling uncomfortable, feeling restless. So they two tend to move together. No wonder they are both what we call mood problems. And they will have other manifestations because they are fearful. You know, when you are fearful, it's like you are in a house and the thieves are knocking at the door. The first thing you notice is you are sweating, the heart is pumping very fast. That's anxiety. So they also develop those kind of features. And each time you are seeing them, they are like sweating, the heart is pumping very fast like they've been running. Sometimes they talk of certain other features. They have a lump in the throat. They are trying to swallow. It doesn't go away. those are some common manifestations for depression. They don't want to mix, they isolate themselves. There are people who stay in the halls of residence, others are going for lectures, they are not going. Even in a house setting, they are not the people that will come out and mix with the family. They will sneak maybe to the table, take away their food, go and eat by themselves in the rooms. There is changed sleep. Sleep is always a problem. Usually it's poor. And early morning, what happens when they go to bed? They are able to sleep, but wake up early and don't sleep again. Because depression tends to get worse as the day begins. So they sleep maybe 9, 10, wake up at 1 or 2, will not sleep again. Start saying, wow, now that another day is coming, what am I going to do? I'm going to go through this suffering again. So poor sleep is very, very, very common. A few may sleep too much, but that's that's not typical. Then there is also change in appetite. The majority of them do lose appetite. They will not want to eat. They find no need for food, actually, because in any case, they are beginning to feel suicidal. So appetite is not something they really have. So they don't eat. Although we get very few that when they are depressed, because sometimes we have this common feeling or saying that if anything else fails, you eat. So for other people, when other things fail, they eat. But these are very few. So you find somebody is depressed, but is emptying the fridge all the time, eating everything and getting a lot of weight. But that's not very, very common. I talked about the bad thoughts or thinking. You lose about the future. They neglect themselves. But I also want to add the issue of self-destructive behavior. When it gets too much, they are saying, like I talked about what is written about in the Bible. They give up on life. They say, God, take me. I want to die. And they plan that, to kill themselves. But some few don't only want to go by themselves. They start looking at the world as a very cruel environment. So they say, now I'm going to die. Now if I die, I'm going to leave my children in this cruel world. They don't deserve to suffer. So they will begin to say, let me kill my children and to save them the cruel world and also kill myself. So you've seen people that have killed others before they kill themselves. And that can be really, really tragic. Others going through drug abuse, and especially the adolescents. A lot of young people are getting to use of alcohol, use of marijuana, use of other drugs, not because of anything else, but because they have that low feeling. And they start to do what we call self-medication. They think they will do that and they get better, not knowing that they are causing themselves problems. I talked about the young ones also getting depressed, and sometimes we see that out of fearing school, especially primary section, dodging school. They have antisocial behavior. They don't want to share anything, even just lending somebody a pen, they will not. They are aggressive, they are violent to their friends in class, and so on and so forth. Promiscuity, we've seen it. I think that's partly when we talk of the teenage pregnancies that have increased during this period. Probably it's out of promiscuity, which arises when people are feeling depressed. They do anything. There is a changed behavior. Then I think that is, I know time is running out. Of course, I will not talk much about the assessment, just to say that when they come to us, there is a kind of assessment we want to make, and you usually see a person that has neglected self, cannot easily talk. They are really low. They are really feeling sad. Even when they just sit in as they are waiting to move into the consultation room, you'll not miss them. You see somebody and you know person is really depressed. They are looking sad. They look down. They can't give easy eye contact. They've neglected themselves. They've not looked after their clothing or hair or whatever. Then already you suspect there is a problem. But of course, when also you begin to talk to them, they are not people you enjoy a conversation with. You ask a question and they take their time to answer. Even when you ask, what is your name? Can you tell me your name? That might take a while for them to tell you who they are. But also when you go to look into their thoughts, they are slow, cannot concentrate. And sometimes they have gone to levels where they are even like beginning to behave like they hear voices maybe which others cannot hear, or they see things that others cannot see. And those are indications that the disease has really become worse. Now, the good news that I would wish to share as our time runs out is that depression, much as it's common, much as it's disabling, it's potentially treatable. Once we identify people early, we can be able to help them get out of the challenges. Apparently, even when a person that is severely depressed does not come to us for any medication, naturally, the disease tends to remit, but after a long time. It takes about 6 months to 12 months for the disease to naturally go down. That is if they survive the suicide, because it's usually the common thing that takes them. If they survive that, they may survive. However, we are able to help them get through the crisis in a shorter time with medications. There are a lot of very, very good medications that we are now able to give and help people to get better. Usually when we start medicines, like today, by next week, Thursday, the person is beginning to smile, is beginning to feel happy, is beginning to sleep better, and to eat. So medicines do help. But there are other biological methods that I will not go into it. But the other that is important are the psychological methods, because it's not enough just to give these people the medicines. We also use a lot of psychological methods to help them cope with the challenges, encourage them to talk to people, encouraging them to share whatever challenges they are going through, looking at because usually they have those negative automatic thoughts, the feeling like, the world is no place to be and that they should go. Then they can be helped with that to get out of those very difficult challenges. That is the counseling, which takes different forms. And I'm glad at least we shall be sharing again more on this tomorrow. And I have a colleague that will mainly be talking about these ones. But we can also talk a lot more about this tomorrow. Then the other is the social treatment. Many times they require a lot of other forms of support. Maybe they have challenges at home. They have challenges at school with the department. They have challenges with income. They have challenges with living situations. So those ones are also addressed, and when that happens, then they do get better. So in conclusion, I want to say that depression is one of the very common conditions that we deal with in society. It is a very serious but potentially treatable condition. Early interventions can be very helpful. That's why we all need to be helpful. We all need to be on the alert, to be aware, get to know that you know the symptoms now, get to see who is going through that. Many times even just talking to them, encouraging them to share, praying for them, helping them to get closer to their Creator, helping them to get closer to health facilities. All these are beneficial and they can help to save a life. My time is over. I really want to appreciate all of you for listening, and we hope together we can make a difference with this disease of depression that is ravaging our communities. Thank you so much. God bless you all.